Good morning, everyone. The secret of change is to focus all of our energy not on fighting the old but on building the new. In face of adversity, we have a choice. We can be bitter or we can be better. On behalf of Santinos Global School, I welcome all parents and my dear students. The COVID 19 pandemic has had a major effect on our lives. Many of us are facing challenges that can be stressful, overwhelming, and cause strong emotions in adults and children. Public health actions, such as social distancing, are necessary to reduce the spread of COVID 19, but they can make us feel isolated and lonely and can increase stress and anxiety. Learning to cope with stress in a healthy way will make you, the people you care about, and those around you become more resilient. Dear parents, today we have an eminent personality, Dr. Rahul Reddy, with us to take us through this webinar on COVID and children. He has done his MBBS from Usmania University, Diploma in Child Health, and MD Pediatrics from CMS Vellore, and also Fellowship in Pediatric Endocrinology from NUH Singapore. Sir, my request you to take over.
Hello, everyone. Thank you for inviting me to this talk. And I'm very glad I'm here today to talk in front of you, both parents and children, during these difficult times of the coronavirus. I'll try to focus on what nutrition should children have during these times and advise you on basic precautions. I'm Dr. Rahul Reddy. I'm a pediatrician at Family Clinic in Santosh Nagar. I'm also a visiting consultant at Hospital and Fernandez Hospital, Hyderabad. So I'll start with my presentation today and take you through the slides. If you do have any questions, please ask me at the end of the talk, and I'll be happy to answer all your questions. There are a lot of myths and facts with regards to nutrition during COVID times. We do hear a lot of varied opinions from different people regarding this food to eat, that food to eat. Clarify a few things in this talk and also advise you on basic nutrition and diet, what children should have during these times so that they can have the immunity to fight infection if at all it happens. So let us talk about the basic protective measures first. During these times, we need to be careful and regularly and thoroughly wash hands with soap and water. Or the other alternative is to clean them with an alcohol-based hand rub. However, if you ask me, I would say the best thing would be to wash hands with soap and not worry really much about the alcohol-based hand rub. If we're outside and there's no soap and water, then we can always use a hand rub. The next thing is that we should always cover our mouth and nose with a bent elbow or tissue. Suppose if we as parents have cough or else if we are sneezing, and then dispose of the tissue immediately. And we should also teach our child to do the same. In this way, we can protect our child and ourselves from getting this infection if at all anybody has the symptoms. We should avoid touching our eyes, nose, and mouth. A lot of us unknowingly tend to touch our eyes or mouth. So this is a common way by which our hands can pick up the infection from many surfaces and then transmit it to us through our nose, eyes, or mouth. So avoid touching the face. That is a very important thing. And one most important thing during these times is to stay at least 1 meter away from anyone who is coughing or sneezing. Even if somebody is not having any symptoms, it's always better to maintain a distance of 1 meter from others during these times. So these are the basic protective measures, which is the hand wash and social distancing. and wear a mask always, and use a proper sneezing technique into a tissue and dispose it of immediately, and avoid touching the face. When we talk about washing hands with soap to prevent the spread of COVID 19, now we as doctors and nurses in the hospital, we really try hard to wash our hands for 20 seconds so that we really maintain sterile and hygiene condition, and so that we don't transmit the infection to the children in hospital. Similarly, during these times, you at home should also wash your hands with soap and clean running water for 20 seconds. So this is important to prevent the spread of COVID, as well as important for your health of your baby and your entire family. Always wash hands before preparing and eating food, before feeding the infant and the young children. It's also most important to wash your hands frequently after blowing your nose or sneezing or coughing, if at all you as parents have any symptoms. And also after cleaning your home, that's another time when you don't want to hold something and then spread the infection to yourself or your child. So that's also when you have to wash your hand well. Now, apart from washing hands and wearing a mask and maintaining a social distance, now main crux of our talk today is regarding the food, and what food should we eat so that we don't catch the virus, or what food should we eat so that we can easily fight the virus. Now, coming to this question, let me talk about what food should we consume to support our immunity. So what all we can do is support our body immunity, and how to improve it. So the immune system requires the support of many nutrients. And where do we get all these nutrients from? We get it from a healthy and balanced diet. So it is recommended to consume a variety of food for a healthy and balanced diet, including whole grains, legumes, vegetables, fruits, nuts, as well as animal source food. Well, if you see what I have written here, it is basically a balanced diet containing enough carbohydrates, enough proteins, enough vitamins, enough minerals, enough fats. So we as adults or children should have all of these in our diet. So there is no single food that has been shown to prevent us from catching COVID 19. There has been instances that or some studies recommending vitamin C or other vitamin D. However, that is all part of the healthy and balanced diet. So once you have a diet which is balanced in all of these, you are going to have definite amount, good amount of vitamin C and vitamin D consumption. Now, when we talk about a balanced diet, you should remember about a healthy plate. So in a healthy plate, 1/4 of your plate should be your proteins containing legumes, or else non-vegetarian food, or else any other proteins like dal. And half of your plate should actually be fruits or vegetables. So if you take your fruits and vegetables, which are very in different colors, yellows, greens, and reds, they should make up half of your plate. And 1/4 of the plate should be actually the grains, the whole grains. We should preferably have good carbohydrates, complex carbohydrates. So we should try to have whole wheat, ragi, jowar, and if you're taking rice, white rice or brown rice, and in equal proportions with a balanced diet you have to take so that we get all the nutrients. When we talk about animals force food in a healthy and balanced diet, we should always have a glass of milk or curd with all our meals so that we get enough of the good calcium, vitamin D, and other probiotics from these things. Along with all of this, we should also have a few nuts so that they can give us the benefits of having the nuts and the dry fruits as well. Now, the common question is, can I get COVID 19 from eating fresh vegetables and fruit bought from the market? So, currently, there is no evidence that people can actually catch COVID 19 from food like fruits and vegetables. So, fresh fruits and vegetables are definitely a part of a healthy diet, and you and your child should consume these as a part of every meal that you have. Now, how should we wash food? vegetables during these COVID times. When you go to the market and get it home, how should you wash it? So wash fruits and vegetables the same way as you would in any other circumstance. So what we would normally do, even if there is not COVID around, we would always wash it cleanly, thoroughly in clean running water, and then we would have it. So before handling them, you should wash your hands with soap and water, and then wash the fruits and vegetables thoroughly with clean water, especially if you are going to eat them raw. If you are going to boil them and cook them and eat, even that is much better. But if you are going to eat them raw, even then you have to have it thoroughly cleaned with clean water and soap. Now, can the virus actually live on food packaging or packets, food packets, or your polythene covers? Coronaviruses are viruses, and like all viruses, they actually need a live human or animal host in order to live, multiply, and survive. And they cannot multiply on the surface of food packages. So, it is not really necessary to disinfect the food packaging materials which we buy from outside. However, when we buy them outside and get them home, we should wash our hands thoroughly after handling these food packages and before eating. So, the only way to maintain precautions while we're handling food packages is actually washing our hands and not disinfecting the food packages. Can the virus transmit through cooked food like animal products? Now, this is a common question because these days we have seen that recently the swine flu had come up, the bird flu had come up, and then we were worried to eat chicken and other non-vegetarian food. So, can the virus actually, this virus, the coronavirus, can transmit through cooked food or not, like animal products? So, let me tell you, there is currently no evidence that people can catch COVID 19 from food. The viruses that cause COVID 19 can actually be killed at temperatures similar to that of other known viruses and bacteria found in food. So, what we would normally do, we would cook them thoroughly to 70 degrees Celsius and eat them. So, any meat or poultry or the eggs, just how we regularly cook them well and eat them, that is how you are going to do even now during these times when you're eating animal products. We should eat animal products, we should eat eggs, we should eat meat and also chicken, and we should thoroughly cook them and then only eat them. Now, this is a common question. Is it safe to go to the grocery store to collect vegetables and fruits? Yes, it is generally safe. But then you need to maintain the below precaution measures as well. So maintain at least 1 meter distance from anybody else in the store, and also wear a mask, even if it is not necessary to wear a mask in these times. You should wear a mask and maintain 1 meter distance. Once home, wash your hands thoroughly, and also after handling and storing your purchased products, wash your hands. There is no currently confirmed case of COVID 19 transmitted through either eating the food or through the food packaging. So, so don't worry. Take all the good stuff, purchase them from the stores, wash your hands well, and eat the food, eat healthy food. Now, during these times, a lot of us tend to get our food delivered from online delivery services. So, is it safe to have groceries delivered? Yes, it is safe to have groceries delivered if the provider, the person who delivers it to you, follows good personal and food hygiene practices. And after accepting the food, the groceries, always wash your hands properly because that is the one step which is the most important one. Now, coming to what is the best disinfectant for surfaces, regular household cleaning and disinfection products will actually eliminate the virus from the household surfaces. So, if nobody has infection at home and you're doing your daily cleaning, then you don't need to do any special measures for disinfection other than the regular things. What you would use, like Lysol or Phenol or whatever regular stuff you would use to clean your floors and clean your surfaces, that can be used. However, for cleaning and disinfecting households with suspected or confirmed COVID 19, if somebody at home has COVID 19, then you can use surface virucidal agents, that is destroying this virus, such as sodium hypochlorite either 0.05% or 0.1%. And products based on ethanol with at least 70% of ethanol alcohol should be used. So either sodium hypochlorite or ethanol based with 70% alcohol products can be used for surface disinfection if somebody else has the virus at home. Now, I get a lot of questions these days regarding vitamin D supplements. Should I give my child vitamin D supplements? Will it help him boost his immunity? So, the actual truth is that vitamin D is made in the skin by exposure to the sunlight. Now, because of lockdown and staying home, definitely the sunlight exposure is reduced. However, if you are eating diet from which you're getting the vitamin D, then also you're going to get good enough vitamin D as well. So, vitamin D can be obtained through the diet from natural sources. For example, fishes like salmon, tuna, mackerel, or fish liver oil, beef liver, cheese, or egg yolks. The other things in addition to these are mushrooms, which have good amount of vitamin D, and cheese has vitamin D, like it's been mentioned here. And egg yolk is actually quite a good rich source of vitamin D. In addition to this, a lot of food is now vitamin D fortified. If you purchase certain food, then you will sometimes notice that vitamin D is already there in that. It is mentioned that it has been added. So those are vitamin D fortified foods. Now, when it comes to vitamin D containing supplements, I am not very happy to give somebody vitamin D containing supplements just as a general rule to everybody. So, in situations where individuals' vitamin D state is already marginal and where foods rich in vitamin D are not consumed and exposure to sunlight is limited, in those cases only, in those people only, a vitamin D supplement can be recommended to be taken. However, this I would not advise you to go to the pharmacy and directly purchase them, but you can always consult a doctor and then take the advice and as per the recommendation. You can also check your vitamin D levels, and if your vitamin D levels are really low, then we need to supplement them definitely with vitamin D. If the vitamin D levels are normal, then it is not beneficial to give any vitamin D supplements, as taking too much vitamin D can also cause high vitamin D and cause to complications as well. Now, can probiotics help prevent probiotics help prevent COVID-19? No, probiotics are just live microorganisms that are added to food or use a supplement to the diet to confer a health benefit. However, there is currently no evidence to support the use of probiotics to help prevent or cure COVID-19. So I would advise you not to just go to the pharmacy or not to take any probiotics by checking them somewhere else that it has been beneficial. No, that has not been beneficial. However, the food you eat, if you're taking good balanced diet, definitely you're going to have good amount of prebiotics in that, which will help you with your immunity as well. Can ginger help prevent COVID-19? A lot of people tend to say that ginger helps and they take a large amount of ginger these days. No, but there is no current evidence to say that eating ginger or taking ginger tea or anything like that has protected people from COVID-19. However, we need to remember that ginger is a food that may have some antimicrobial and anti inflammatory properties. So, in good amounts, in a balanced amount, as we always take in our food, we should include it as part of our diet and we should have it. But we should not have excessive ginger just to prevent us from COVID 19. Can garlic help prevent COVID 19? Taking too much of garlic, taking garlic thrice a day? Not really. So, no, there is no evidence that eating garlic has protected people from COVID 19. However, just like ginger, garlic also is a food that has some antimicrobial properties and it should be included as part of the balanced diet that we spoke about and should be included in while you make your curries and other things as well. Now, I don't know if you have heard about this, but some say that pepper can also help to prevent and cure COVID-19. So no, again, there is no evidence that adding hot peppers to your food can prevent or cure COVID-19. So you should have just the general amount of hot peppers and pepper in your diet so that you can get a good taste to your food and then you can have it. With this, we have come to the end of our talk. I'll also show you a picture of the balanced diet, what I'm speaking about. So this is how a good balanced diet looks like, and this is what your child should have during these times. When you give a plate to him, make sure that 1/4 of the plate should be of fruits for breakfast, lunch, dinner. This holds good for all of them. So have fruits as part of your diet regularly. Have vegetables, which is 1/4 of your plate. So both fruits and vegetables combining, you're having half of the plate, very good, nutritious fruits and vegetables. And 1/4 of your plate should be your proteins, which is your dals, lentils, legumes, and animal proteins. And 1/4 should be the grains, which could be the rice, which could be the whole wheat, chapatis, ragi, jowar, so anything which is there. And don't forget to always include dairy, milk, or curd as part of your diet. It has a lot of benefits, and you should include it as part of your diet as well. Now, we've come to the end of the talk. The basic points which I would like to summarize again are the prevention measures of social distancing, putting a mask properly, and also hand washing thoroughly before touching, before and after most of the things that we do. And also, I've told you about the healthy balanced diet, how a child's healthy plate should look like, and also what other things we should have in our diet, like good source of vitamin C, a good source of naturally available vitamin D in our food is rather enough, and we do not actually require any other supplements. With this, um, I hope this session was useful for all of you, and I'll be very happy to take any questions from you so that it will benefit the parents. I have also left my contact number, which you can always contact me on in case you have any doubts further regarding COVID-19 or regarding children. Yeah. So thank you so much for inviting me for this talk again, and it was a pleasure to be with all of you. And thank you again.